Treatment planning essentials. So where is everything that you need, and how can you find it? I just want to check in on us time-wise. Are we going to
We go
12
to-
or 12:30 before we take a break? Sorry.
We're going to take an actual break by 12:45.
Okay.
So anytime we break before that is added time, and also question and answer time.
Okay. All right. So we'll eat. All right. So treatment planning essentials, and where to find them. There are three essentials that are absolutely critical in your treatment plan. So you need to be able to see what level of care was authorized. You need to be able to understand what the clinical focus of care is, and you need to be able to see what strengths are going to be developed. These three things are absolutely critical because they set up what it is that you can receive in terms of supports, what people are going to work on in terms of addressing or ameliorating in terms of the clinical focus, and then how they help you move forward, which is about developing strengths. So we'll go through each one of these. The level of care sets the expectations for the intensity and coordination of treatment. Now, when we say level of care, people often confuse that with the setting of treatment. So for instance, somebody might say, well, it's a hospital level of care. Well, that's not really a level of care, that's a setting of care. Hospital is a setting, an office is a setting, your home is a setting, right? But a level of care, what we're really talking about is the frequency and the intensity of care that's provided. And higher levels of care typically enable you access to more frequent, more intensive care. So, instead of getting care for 45 minutes every other week, you might be able to get care for 2 or 3 days a week, 2 or 3 hours at a time, right, at a higher level of care. So that's what we're talking about in terms of the level. If you qualify for a higher level of care, it enables access to additional types of formal care, which, as we know, Idaho is still developing. It might also enable access to non-traditional care or supports, or it might enable your access to formal coordination of care. So it might be they have to, if care is identified as complex, then they would have to provide care coordination that moves across different systems or different providers to make sure that care isn't at odds with each other, isn't duplicated, and is actually helpful. That's the idea behind wraparound and targeted care coordination, is that there are likely multiple providers or multiple systems involved. And so you want to be able to make sure you have similar goals that folks are working towards across providers and systems, even though you have different interventions that are provided by those providers and systems to reach them. You can find your level of care on the completed CANs. So once the clinician enters that CANs online into the ICANS system, in the background, it compares all of the items that were rated to an algorithm that it has that then identifies what level of care or intensity of care you've qualified for. And then it prints that right out. So it computes that level of care based on the CANs ratings and prints that out at the end of the completed CANs. So if you ask for your copy of the CANs, and this is a screenshot right down here where it says recommended level of care, I've literally copied this from a de-identified CANs assessment. And it literally will show levels 0, 1, 2, or 3. as your level of care. And the higher level of care, as you might guess, provides the expectation that there will be more intensive services and better coordinated services as you move up those numbers, right? So before you start any treatment planning, always request a copy of your completed CANs, because it will tell you the recommended level of care, which is set up some expectations for the frequency and intensity of services that they'll be noting and providing per the interventions section of your treatment plan. There's additional information about how ratings on the CANs lead to a level of care recommendation. So if you go to this link right here, there's a couple page PDF that walks through how those algorithms are built. I wasn't able to find Idaho's algorithm for level of care on any publicly available sites. Other states literally will put the algorithm up there so you can see exactly what CANs items and ratings lead to what levels of care. The algorithms are meant to be open. They're meant to be public. I can say that because I've designed them, many of them for many states. And it's not intended to be a secret process. It's intended to say, you know, if you have these needs and this level of need or risk, you should be getting more intensive care. So I know Washington State has their algorithm publicly provided on their WISE website. I worked with them for quite a while. And I'm not sure exactly where it is in terms of yes, but those are the one difference between the CANs and many other instruments is that's not designed as a proprietary or secret or hidden algorithm. So even if you look at Washington's algorithm, it's going to be fairly similar to Idaho's. So that shouldn't be a secret. Although I didn't immediately see Optum's. Yes, and I know that there are Optum clinical guidelines. It's an interesting bit of a weird situation in that that Optum has their own tool that they indicate using, but yes, which is legally mandated to be the level of care determination system, uses the CANs. So you should not have an experience where your level of care is indicated as 2 or 3 on the CANs, and then you get some sort of Optum decision that you don't qualify for those services. That should not be happening. If it does, I would that's the point. I would involve the Federation of Families and anyone else at that point. All right, we're a little off target here. Just keep that in mind. All right, level of care. The implications for you. So, you know, one of the first things that I would do if I was working with a provider and I got my CANs assessment and it has the level of care, I ask for what the services are that are available at that level of care on your CANs. And I would also ask, what's the frequency of care that can be provided at that level, right? So that it's both at the forefront of your mind and at the forefront of their mind as they're starting to work through this, so that people are really on the same page about where this is at.